Okay, so we're gonna do one of my favorite cases today on a young woman. She feels like she has a lot of excess cheek area here, which is really the location of the buccal fat pad. So we're gonna be doing a buccal fat excision, also known as in Spanish a bichectomy, for the space of Bichat, which was a French surgeon. And we're gonna be removing those fat pads with an incision inside the mouth, taking out that extra fat and giving a much more sculpted facial look. Okay, so we're here with a very pretty young lady that we're gonna be doing buccal fat pad excision on. She's been kind enough to let us do a short video of the procedure. She's already gotten Valium, which is an anxiety medication, just to kind of help relax her. This is typical of what we do with all of our patients. And she's been able to relax here at the office for a little while, and now we brought her into the room. And we're gonna start the procedure. She's already had local anesthesia injected on the inside of each cheek. So that will help a lot to decrease any pain that she may have, and also to help decrease any type of blood loss during the procedure, which is very, very minimal. So now we're gonna go ahead and get started. So we have achieved the buccal fat pad here. She's got great fat. It's very pretty yellow fat. She's got quite a bit of it too. So we're gonna be taking all of the majority of this fat out. We don't wanna hollow her out too aggressively because we don't wanna age her too quickly, but we definitely wanna get all this fat. So my assistant is gonna grab this fat, and we're just gonna continue to retract. So far she's been a trooper. She hasn't really complained of any significant pain, and usually the combination of Valium and the combination of the local anesthetic before the procedure really helps out a lot. Sometimes it's a little sensitive deep in here, but if that's the case, you can always inject more local. Okay, so I'm just marking now exactly where I want to make my incision. Again, you have to be very careful. You got to know where the parotid duct is at all times. Never lose sight of that. It's a very important anatomic structure. But basically 2 millimeters below the parotid duct. And again, we've already anesthetized her. And I'm just making this small incision through the mucosa. And gonna make a small incision and then spread through the muscle. If you're having a hard time finding the buccal fat pad, your assistant can push on the outside of the cheek, and it'll deliver the fat into the field, and it'll make it a lot easier. The other technique that I've used a lot is you can use the tip of your suction, and if you place the suction tip inside of the wound, it'll typically suck the fat right out of the buccal fat pad, and you can take it out that way. All right, so we already have found the buccal fat. She's been an amazing patient. I mean, this is typically not that easy to do, and so she's made it that way for me today. And there it is. So it's a nice bunch of fat here. Okay, so we've completed the procedure, and we just wanted to show you the fat on the right side, the fat on the left side. We took symmetric amounts of fat from each buccal fat pad for her. Again, she made this procedure very easy for me today. The anatomy was very clear. It was very easy to remove the fat. And so we've done that, and she tolerated it exceptionally well. No significant complaints. So I thank her again for letting us shoot the video and illustrate for everybody to see.